the electrocardiogram. Electro means electricity, cardio means heart, and this represents a graph. So then what is an electrocardiogram? It's the graphical representation of the electrical activity of your heart. In other words, it's a recording of the heart's electrical activity, usually abbreviated ECG or EKG. Traditionally, ECG means 12-lead electrocardiogram, which gives a tracing from 12 different electrical positions of the heart. In order to achieve that, we are going to use these cables. This is the electrocardiogram machine, and this is the paper where we are going to record the electrical activity. These cables are these cables. These in white are the electrodes. We have V1, V2, V3, V4, V5, V6, and these are considered the chest electrodes. We also have another four, 1, 2, 3, and 4. They are considered the extremity leads, basically the arms and the legs. This one is for the right arm, this is for the left arm, and this is the left leg. This one right here is for the right leg. So therefore, we have a total of 10 electrodes. One concept to understand is that although it is called a 12-lead electrocardiogram, it uses only 10 electrodes because certain electrodes are part of two pairs and thus provide two leads. These 12 electrocardiogram leads are divided in two sets. The 6 extremity leads, these ones in blue, which are going to record voltages on the frontal plane of the body, and the 6 chest precordial leads, which are these ones right here in red. That 6 chest leads are going to be these ones. And the extremity leads are going to be these ones right here. Going back to the previous figure, the red ones are pretty much self-explanatory. We have V1, V2, V3, V4, V5, and V6. The representation of the blue ones, we can see them in this figure right here. You can think about this like taking pictures using multiple different cameras. If you use the camera and you take a picture of the face, this is the figure that you're going to get. Taking a picture of the back of the head, this is going to be the figure that you're going to see. And you can see in here, depending on the angle that you are using, you're going to get multiple different figures of the same person. Using the same analogy, if this is the heart, then taking pictures from the heart from different angles are going to give you different pictures. What do these lines represent? That are the electrocardiogram waves. We have a P wave, a PR segment, a QRS complex, an ST segment, and a T wave. The normal sinus rhythm, which is provided by the sinusoidal node, produces these waves. The P wave represents the atrial depolarization, and the atrial depolarization causes the atrial contraction to pump the blood from the atrium to the ventricle. The QRS complex represents the ventricular depolarization. This ventricular depolarization causes the ventricular contraction to pump the blood out of the heart, for example, to the body. The T wave represents the ventricular repolarization. The ventricular repolarization causes the ventricular relaxation. This relaxation allows the ventricles to receive the blood coming from the atrium. The atrial repolarization that causes the atrial relaxation is not seen in the electrocardiogram. So the atrial repolarization is very weak. And I'm adding this red wave in the electrocardiogram just to give you a graphical representation of a possible atrial repolarization. But what happens is that the QRS is so strong and so big that it covers this red wave, which will represent the atrial repolarization. And that is why the atrial repolarization is not seen in the electrocardiogram. So this electrocardiogram waves is what is recorded by the electrocardiogram machine. And this is the way you're going to see it in a normal electrocardiogram. You can see the precordial leads 1 through 6, and you can see the graphical representation of these 6 waves. Even though you have all these waves in there, they are not the same. For example, this wave, It's not the same as this wave right here. They appear to be the same, but they are not exactly the same because they all are showing the electrical activity of the heart, but they all are showing the electrical activity from different angles. The reason for performing an electrocardiogram is to obtain information about the electrical functioning of the heart. Medical uses of this information may vary, but one very important indication is chest pain or suspected myocardial infarction or heart attack. One indicator of a heart attack displayed in an electrocardiogram is ST segment elevation. As you can see here, this is the QRS, and it's supposed to go down, but it keeps going up and it forms an elevation. This one, see there's an elevation in here, and this one is supposed to go down here, but it doesn't. And unfortunately, this ST segment elevation is associated with a heart attack. As you can see right here, part of the ventricle is dead, and that most of the time is associated with an ST elevation in the electrocardiogram.